Hip resurfacing, if done well and in the right patient, has a high probability of giving the patient a very high level of function and lasting a long time. The benefit of a hip resurfacing is rather than cutting off the entire diseased joint at the neck, rather we preserve the femoral head itself by shaping it and putting a metal cap on it and doing a similar thing with a socket. And this seems to tension the tissues in a better way and seems to feel like a more natural joint, certainly when measured in lab studies and even when extrapolated to patient functions in the real world. There are, however, specific risks about doing a hip resurfacing, which can include a femoral neck fracture, which can happen at any point following surgery, loss of blood supply to the head resulting in a condition called avascular necrosis, and in a very small percentage of the population, an allergic reaction to metal or metal debris. In a young adult male, less than 50 to 60 years old with good bone stock, the chance of getting any of these complications should be less than 5%, meaning the vast majority of patients will do very well. During your stay in hospital, you'll see the anaesthetist who will decide whether you're suitable for a general anaesthetic or a spinal anaesthetic. Both are safe, and that's a discussion that you will have with the anaesthetist. Generally speaking, surgery will take just under 2 hours, and usually we'll aim to get you walking with crutches 3 or 4 hours after surgery once the anaesthetic has worn off. Most people will go home the following day on crutches for the next 4 to 6 weeks, and I will see you in clinic at 2 weeks and at 6 weeks to ensure that you're progressing well in the early stage. Thereafter, it's ideal to have a once-a-year checkup just to make sure you're functioning well and you're happy with your new hip resurfacing. Most people are off crutches by 4 to 6 weeks, walking comfortably, in the gym, engaging with physiotherapy, perhaps on an exercise bike or swimming. By 3 months, the majority of people are able to do some impact activities at low intensity, which could include jogging or doing some light weights on a resistance machine. And all being well, by 6 to 9 months, you're back on the field, playing some gentle football, tennis, golf, or whatever activities you enjoy doing.